Hi friends, have you heard the term dysarthria or slurring or indistinct speech? The causes are many. The cause may be sometimes there can be local problems, some trauma, infection in and around the lips, mouth or throat, some local pathology. Or the cause may be in various maybe the nerves in the nerve system and the brain or anywhere in and around the brain, spinal, the other nerves in the nerve system. So you know what happens when you speak, the speech will be slurred, it would be indistinct, or it won't be intelligible to others. Sometimes it will reach to an extent that it will become called anarthria. It's a total failure of communication. You can't speak out because of the problem, because of the articulatory abnormality. Actually, it's a motor speech disorder. This is not a language disorder. Language disorder means that you can't get words, you can't understand. It is like you are in a different country where you don't know how to speak, how to understand. It is not like that. You fully knows everything except that you can't speak out because of some problem in the articulatory apparatus. All right. So the problem may be in the brain, is called a central lesion or upper motor neuron type of problem, maybe in the motor cortex or in the subcortical white matter, in the capsule, or maybe in the midbrain pons, medulla, or in the corticobulbar tracts. That is the upper system. Or there can be a problem in the cerebellum, that is you call it as ataxic dysarthria, or the problem may be in the basal ganglia, like hyperkinetic or hypokinetic. Or this may be a low motor neuron type or a flaccid dysarthria, where the problem may be in different area. This may be in the muscles in and around the mouth, in the tongue, or in the palate, or in the throat. That's called a muscle cause of the flaccid slurring of speech. Or the problem may be in the myoneural junction, something like a myasthenia gravis, where there won't be enough neurotransmitters released at the synapse to speak or to do any activities. Or the problem may be the nerves, like many nerves are there, like the facial nerve, the vagal nerve, or the hypoglossal nerve. If there are any abnormality or lesions or any damage to these nerves, also causes dysarthria or difficulty in pronouncing certain words or phonemes or letters or sentences. Okay. Then there are the nerves, all the nerves arise from certain centers called nucleus. If these nucleus are lesion or abnormal due to a motor neuron disease or something which would affect these cells, then you similarly you would get a difficulty in speaking, or the speech gets slurred or disarticulated. So all these are called the low motor neuron type of flaccid dysarthria. Sometimes there can be a combination of everything, like in a motor neuron disease, cerebellar problems, spinocerebellar ataxia, Parkinson plus syndrome. So there are the condition is quite common in the elderly. So whenever someone speaks normally, suddenly his speech gets slurred, immediately it tells you that some problem has occurred in the brain or somewhere. So you immediately have to investigate and evaluate to look for a stroke. But on the other hand, if the particular patient has got a slowly progressive, insidious onset, gradually progressive difficulty in articulating, in pronouncing letters, then you have to evaluate for any of the above mentioned condition. The problem may be the brain, this may be in the cerebellum, this may be the Parkinson disease, basal ganglia, or any of the other structures that I have mentioned just now. Sometimes there's a condition called a hypothyroidism, where there is the speech gets slurred, the patient will be slow, apathetic, lethargic. So you should be extremely careful, look out for a hypothyroidism. Okay. And if you find someone who speaks very softly, this is called a monotonous soft voice, that's usually common in Parkinson's, or something like a Parkinsonism or Parkinson plus syndrome. Sometimes some person would come with dysarthria or slurred speech in their 50s, 60s or 70s. In those cases, you have to think of at least two conditions. One is a degenerative disease, something like degenerative ataxia or a spinocerebellar ataxia, sometimes some paraneoplasias or something which would occur with a cancer or which can antedate or can occur with that or it can occur later. So you have to look out for something like cancerous condition or something like some degenerative, some nerve getting damage due to motor neuron disease or spinocerebellar ataxia, Parkinson plus syndrome, Huntington's, Wilson's, Niemann-Pick's, many such disorders are there which would cause dysarthria. Okay, alcoholism, many drug interactions. Sometimes some people are taking drugs for epilepsy. If the dose is slightly higher, then the speech gets slurred or dysarthric. So then you have to verify the drugs that is taking and you have to adjust or modify the medication. So in short, what I want to drive is that dysarthria or slurred speech is common. It can be caused by differing mechanism, maybe in the brain, the spinal brain, the cerebellum, the brainstem or the basal ganglia, or maybe due to any nerve, muscle or myoneural or nuclear problem like a motor neuron disease or any nerve pathology. One more thing I would like to highlight is that you must have seen many people with the Bell's palsy or just a facial palsy. But if you find there is a difficulty in articulation with the facial weakness, don't diagnose facial palsy or Bell's palsy. It must be most likely a lesion in the brain. Okay, something like a stroke or something. So facial palsy with the dysarthria, always think of a lesion high up, not in the local pathology. Okay, so the investigation, you have to do all the investigation, maybe thyroid function test, calcium, MRI and other evaluation for all the conditions that I have just mentioned. And the treatment would be treat the underlying cause. You should get the help of a speech and language pathologist, speech therapist, physiatrist, those people who are in rehabilitation, solo therapists and all. You should have a teamwork so that you can help the patients better and better. At times you would find some patient with anarthria, that's a total lack of speech at all. In that case, what you have to do is you can have the assistive device like a smartphone, computer or various other assistive devices are there in the market that you can check the online, or you can talk to your speech therapist who would advise you more on these aspects. So let me stop here telling you that the dysarthria should be a little careful. Sometimes this need evaluation and investigation. If you have got any comments or queries, you are welcome to do so. Thank you very much. Bye.